Imagine going to a normal annual well woman checkup and your pap results come back abnormal, so then you get a biopsy done and it comes back cancer, but it's not just any type of cancer, it's non-HPV related cancer, which basically means it's rare. You're just going through life and you're also 21 years old. This is what happened to the story that we're going to talk about. This young lady who essentially has cervical cancer and it's stage 4. And we're going to listen to her story as well as discuss what is non-HPV related cervical cancer and read this article that talks about what causes non-related HPV cervical cancer. And if you're new here, my name is Christy Araba. We talk all things women's healthcare, and we're just going to dive into the story, so let's get started.
To just go get a normal pap smear from my doctor, my OBGYN, and it came back abnormal, so she just thought it was like HPV or something. And, you know, it was fine. We'll do a colposcopy, which is basically where they go into your hoo-ha and they like take a chunk out of it and then they like biopsy it. So that is what they did to me. And my lab report came back and it came back as an adenocarcinoma, blah, blah, blah. It's like one of the more rare ones. So that's how I found out I had cancer. I have cervical cancer.
So a few things that she mentioned. She said it was her normal checkup, meaning she just went to an annual gynecological exam, and her pap smear was abnormal, which then resulted for a colposcopy. So colposcopy, essentially it's just visualizing the cervix, and we put a dye, and the dye picks up any cellular changes, meaning that we see something kind of popping up on that cervix. And then if we see something, we biopsy that cervix, and then we send off to the laboratory to tell us what those cells look like. We take a biopsy of the outside portion of your cervix as well as the internal portion. And what we're looking for is essentially, what does the cells look like? Is it cancer cells or not cancer cells? In her case, hers was adenocarcinoma. So that basically means, I'll break it down, adeno is just gland, and then carcinoma is essentially cancer. Adenocarcinoma is basically cancer cells of the gland. The gland is what lines the organs, and depending on where the gland is located, that's the cancer that you have. So in her case, it's cervical cancer because it was a glandular portion of her cervix.
Ran a bunch of tests, they did a bunch of blood work, blah, 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 scans, all that stuff, and basically came to the conclusion that it was stage 3 because it was in my cervix, in my uterus, down my vajayjay, and then there was a couple lymph nodes below my diaphragm, down here, that were affected.
She mentioned a few things, and one of them was that it's at this moment stage 3 cervical cancer, and it's because it's confined to that space. So she said it was her cervix, her uterus, her vagina, and then also she mentioned that her lymph nodes that were affected that were below her diaphragm. And I'm just going to assume that she's referring to her inguinal lymph nodes, which is within that pelvic region that was affected. So at that point, it's still stage 3 cervical cancer.
So I went to go get radiation and chemo and all of that, and my doctors were pretty sure that it was going to be curative. My cancer is also non-HPV, which is 1% of cervical cancers are HPV, and mine is not. And apparently my cancer is very aggressive and very stubborn because I went to go get my PET scan after my initial chemo and radiation, and it turns out that it went from 2 lymph nodes to about 12 all over my body, and the doctor felt that it was no longer curable, which means that it's terminal, and it is now stage 4 because it is spread all throughout my body. So that is actually why I'm doing full-blown chemo now.
As she stated, it's now stage 4 cervical cancer because it has spread to the rest of her body. And I just want to say she's incredibly brave for sharing her story. I think it's hard enough to be diagnosed with cancer, And on top of that, it's hard enough to speak about it, and it's hard enough to share what's been going on with your life and everything that you're dealing with. So I truly applaud her for being so brave to discuss what's happening to her, because this is the reality of life. Like, this is what happens in life, and you go through journeys, you go through trials, tribulations. You just have to kind of keep moving forward and think positive. She's just amazing in sharing her story, and she also talked about how she is just looking forward, trusting God, and really just going about living her life to the fullest and to the best of her ability. And I think that's an incredible mindset to have. So I 100% applaud her for sharing that. I also want to discuss the symptoms of potential cervical cancer. So she's going to talk about 2 symptoms that she experienced that she eventually realized that it was leading to cervical cancer, or she had cervical cancer. And also talk about other symptoms as well that you might experience if you have potential cervical cancer.
So one of the first symptoms I had was sleeping like a lot, like way more than, the person who just says, yeah, I sleep a lot. No, it is like I was sleeping for like 5 extra hours a day, like as a nap.
Sleeping all the time. Why does this happen? This happens because cancer cells are energy vampires. That means that they're draining everything out of you to then grow themselves. So they're taking from you so they can build themselves up. And when they do that, you feel super tired. That means that you just you're drained. You feel like I cannot function because you don't have any energy because you are drained. So the cancers, they're feeding themselves, and that's how they rapidly grow, because they use that energy to grow, expand, and also spread to the rest of the body.
Another one is I would get really bad abdominal cramps, period cramps, but amped up to 1,000,000. They would hurt so bad. I remember being on my hands and knees in the bathroom, praying to God, just stop these.
Super painful cramps, none like her normal cramps, times 10, super painful. So why does that happen? Well, it happens because, remember, like I said, the cancer cells are energy vampires. They're taking all the nutrients, all their energy, and they're basically being selfish, growing themselves, and then multiplying and spreading. Normally, when you have a period, you're shedding your endometrial lining. So it sheds from the lining, it goes out into the cervix, and then it goes out into the vagina, and then to the rest of the world, where you can see it on your pad, your tampon, your underwear. And so in that process, naturally you're gonna have some pain, right? So this is beyond not having cancer. So naturally you're gonna have some pain, right? You take ibuprofen, you do a heating pad, and then you feel fine and you go about your day. When you have cervical cancer, her cancer was glandular, meaning that it was within the endocervical region, and because it was glandular in that region, the cervical cancer cells were super happy when she got her period. So that means that, you're already in pain, they're gonna continue to add on to that pain because they're energy vampires. They're draining her of her energy. So think about when you are on your period, you are already tired, you're already in pain, you're already miserable, and now you have a cancer cell that's draining you of everything that you already low on. It's horrible. So as she described with her symptoms having that painful cramping, it's 100% correct. That is usually what happens because of the cancer cells. I would also like to add some additional symptoms that some people might experience if they have cervical cancer. One of them could be a weird bleeding pattern. So that means that your periods are coming more heavy than they usually are. They're also more painful. Let's say you're menopausal, meaning you haven't had a period in 10, 15 years, and then all of a sudden you're having a period that is 5 days long, 7 days, and it's heavy. That's very suspicious. That could be a sign of cervical cancer. There's also, of course, pain. Sometimes you can have bloating, you can have swelling, you can have a weird bloody kind of discharge as well. That's another sign for cervical cancer. So with all those symptoms that I talked about, I don't want to fear monger, because the things are, it could be cervical cancer, or it could be other things, because a lot of things in women's health, especially with gynecology, they appear the same. So could it be cervical cancer? It could be. Could also be endometriosis. Could it be fibroids? Could it be a cervical polyp? Could it be endometrial polyp, right? Could it be an STD? There's so many things of what it could possibly be, which is why you should always go see a healthcare provider if you're unsure, to get testing, to get screening, to kind of get to the bottom of what is going on in your life, so you can get some answers and narrow down exactly what's going on. Next, I want to break down this narrative review article that talks about non-HPV cervical cancer. The title of the article is Research Progress on Human Papillomavirus Negative Cervical Cancer, a Review. So I want to scroll down to this part here that talks about HPV-negative cervical cancer possible causes. So at like 2.1, it talks about tumor misclassification. So what does that mean? Essentially, it talks about how tumors need to be classified in the right category to make sure that we're not missing something. As in, is this truly HPV negative endometrial cancer development involving the cervix or other sites causing distant metastasis of HPV negative tumors may lead to misclassification as HPV negative cervical cancer. So as I stated, essentially, is this truly HPV negative, or is it not and you just misclassified this whole thing? So therefore, for HPV negative cervical specimens, okay, further differentiation can be achieved by immunohistochemical staining of tumor and stroma. So this basically means you gotta look further what's going on. That's really what this means. And then it talks about, for example, negative for estrogen receptors, progesterone receptors, all these other receptors basically can suggest that it's adenocarcinoma. So that means that that's that rare type of cancer that she was talking about in her video. And then it also talks about if it's the opposite of that, meaning is it positive for the estrogen receptors, the progesterone receptors, then it should basically suggest that it's endometrial adenocarcinoma. So that is really what it's trying to say. Basically, you gotta figure out, did you really miss it? Is it really HPV or is it not HPV? That's what it talks about. So then I'm gonna talk about the next section. Second part talks about the latency. What does that mean? That just basically means delay. That's all that means. So we're gonna look at that article in that section and see what they mean. I'll break it down for you guys. The latency period from HPV infection to the appearance of cervical cell changes. During this period, the immune system suppresses the virus, preventing active replication. So basically, your immune system is suppressing the HPV, which is basically a good thing. You kind of want your body to do that. If you're exposed to HPV, your body naturally clears it out. I'm sure you've heard before, if you get your pap done, it's, let's say, abnormal, and they'll say come back in a year, and then within 1 year to 2 years, the HPV clears on its own. Essentially, you kind of want that because you want it to get out of your system. This article or this section is saying that, well, there might be that delay, that like weird in-between time. So how do we really know? Maybe you still have it, maybe it's still there, but the method that we have to detect the HPV, even at its lowest format, maybe it's not good enough to say you have HPV. Does that make sense? So I'll kind of re-explain again. So look at this part right here. It says, this can lead to a higher chance of false negatives due to low HPV DNA load, even in HPV positive patients, which may not be detected by current HPV testing methods. But, well, to wrap up, like I said before, HPV generally clears up on its own within like 1 to 2 years. So again, it ends at this part that says, from cases with precancerous lesion or disease progression, most HPV infections disappear within 2 years. The next part of this article talks about errors in HPV detection method. So this basically means that currently there's two ways of detecting HPV. There's the nucleic acid and the non-nucleic acid amplification method. And I'm gonna read about what it talks about and also summarize it because this section's a lot, but I'm really gonna break it down just to be a little bit more easier for everyone. Detection methods, classified into nucleic, and of course, non-nucleic signal amplifications. This just talks about the different types of basically signal amplification that there are. And it goes down to right here where it breaks down issues that comes with that. So to basically conclude this, current HPV test primarily focuses on screening for high-risk HPV types, limiting the detection of non-high-risk HPV types that may also contribute to cervical cancer. So this means that there is high-risk HPV that we know directly or likely leads to cervical cancer. There are other, hundreds of HPV out there which can cause cervical cancer, but they're not as strong to cause cervical cancer. So this part of the section is saying that, well, are you really picking up the right kind to make sure that it's not cervical cancer? So that's basically what this section is saying. Limitation can result in some cases of false negative results in HPV testing. All right, let's move on to the next section. The last part on this article, it talks about sampling errors. So it's pretty straightforward. It just talks about, are you getting the right sample to then have the right data to make the right conclusion? That's all that it talks about, but I want to break it down just a little bit, and I want to start by going to the first part. It says, in addition to, of course, detection methods for false negative results in HPV testing, it can also be attributed to sampling errors. So this goes down by saying small lesions may not yield cells from relevant lesion site. Sampling from inflamed or necrotic areas can result in poor cell viability. Prolonged specimen transport time can lead to cell degradation. So this basically means that getting the right sample is essential, and transporting as well is a factor. So that means that, are the specimens going to die on the way to the lab? Because if it dies, then I can't really know what's going on about it. Pretty straightforward. And then also the presence of blood or other chemical agents in the sample can also contribute to false negatives. Again, it just says get the right sample. That's all really straightforward. Just get the right sample, which then can tell you the right information. And so it just concludes, therefore, in cases of cervical cancer with negative HPV testing, alternative testing methods based on different principles should be considered for further validation. And it just says, get the right data. That's really all that it is. And that's pretty much it. Everyone, you have reached the end of the video. If you stuck this long, thank you so much. And I hope you enjoyed just learning about cervical cancer and also getting to hear a bit about her story and her being diagnosed at such a young age for cervical cancer, and especially it not being HPV related cervical cancer, it's non-HPV related cervical cancer, which is so rare, and for her just being so brave to share her story. So overall, I hope you guys liked the video. Please like, share, comment, do whatever you please, and I'll just catch you guys on the next video. And also watch my pap smear video as well, where I talk about tips and tricks on help navigating, your first pap, or if you're an OG pap goer and you've been getting it all your life as well. Feel free to watch that video too.